Endometriosis affects about 10-15% of reproductive aged women, representing about 176 million affected women worldwide. Despite the wide diffusion and increasing healthcare awareness of the disease, the diagnostic delay is still a reason for concern. Globally, the delay from symptom onset to diagnosis is currently estimated at 7-11 years. Several factors contribute to late diagnosis, such as symptoms overlap with other conditions, frequent normal findings at clinical examination, normalization of pain by patients, family and health professionals, different personal attitudes towards menstruation, and lack of information on endometriosis and correlated symptoms. Endometriosis pain symptoms have a negative impact on patients' quality of life, a state of health that has been described as worse than death. The patients are affected in their daily life activities with a reduction in social life, absenteeism, and productivity loss at school and work, difficulties in sports activities. Emotional well-being is impacted as well, with high rates of depression, anxiety, and emotional distress. Half of women feels that endometriosis symptoms have a negative effect on their relationship, leading to self-perception of being inadequate and guilty. Endometriosis is also an economic burden, leading to direct and indirect costs for the patients and the society. The diagnostic delay of endometriosis aggravates these problems. An early diagnosis must be pursued either by healthcare professionals or patients. As symptoms onset, conveys referral to specialized gynecologists is advocated since it allows the early detection of the disease. Symptoms of pain should guide the ultrasound diagnosis performed by dedicated practitioners in endometriosis referral centers. Diagnosing endometriosis as soon as possible leads to appropriate and timely medical therapy. The aim is to prevent pain sensitization, preserve fertility, and avoid unnecessary and repetitive surgeries, leading to an improved quality of life.
The diagnosis of endometriosis in adolescent girls is particularly challenging and can be missed even by the most meticulous gynecologic specialists. Indeed, endometriosis in adolescents differs from elder women in terms of clinical history and risk factors, in terms of symptoms, and of intraoperative appearance of the lesions. A comprehensive clinical history should be collected, focusing especially on risk factors for endometriosis in adolescents, such as early age at menarche, family history of endometriosis, and history of physical or sexual abuse in childhood or adolescence, severe dysmenorrhea resistant to NSAIDs and oral contraceptive, chronic pelvic pain with significant interference with daily activities, resulting in school or extracurricular absenteeism, and finally, the presence of obstructive Mullerian anomalies. Symptoms are also peculiar. Dysmenorrhea is present in 50 to 60% of symptomatic adolescents, while a cyclic chronic pelvic pain and abdominal pain are common, as well as gastrointestinal symptoms, is to say constipation, diarrhea, nausea, and vomiting. Moreover, migraine is also common. Intraoperative appearance of peritoneal endometriosis lesions is different from elder women and may make the recognition of the disease difficult for surgeons. In fact, endometriotic implants may frequently present as red, clear, or white lesions, shiny vesicles, and thin peritoneal adhesions.
We chose to call our project Mona Lisa Smile, inspired by the words of Ivo Brosens, who compared the presence of endometriosis in adolescents to a Mona Lisa smile, given its mysterious innocence and ambiguity. The comparison underlines the peculiar aspects and characteristics of the disease in adolescents, which make the diagnosis challenging for clinicians and more difficult than in adults. The aim of our project is to educate and train healthcare professionals, both general practitioners and gynecologists, regarding recognition, diagnosis and treatment of endometriosis in adolescents. We strongly believe that the awareness about endometriosis among healthcare professionals represents a crucial point and a priority in order to facilitate an early diagnosis of the disease in young women, give a proper treatment to improve their quality of life, and potentially prevent disease complications in their adult life.